people think it's never going to happen to them. And we know COVID doesn't think, well, if you're white or black, it's going to attack you. It attacks anybody.
You are absolutely right in that it doesn't discriminate in terms of who it infects. But the problem is, because people from black and ethnic minority communities tend to also have these other medical conditions, like diabetes, like high blood pressure. That's the reason why when people from these communities got the virus, they became sicker, they were more likely to be admitted, and very sadly, they were more likely to die.
Sure. Affinity Xtra. Be extra.
Hey guys, this is Roger here on Affinity Xtra, celebrating gospel musical Black origin, and also we do talk on topical things, especially on my personal show, The Edge, because we keep things edgy, and there's nothing else but edgy than if we talk about COVID, talking health and black people with a expert. And again, it's beautiful to see a doctor. Well, doctor, I have to be proud to say doctor, I have to say that loud because I'm proud to see people, higher professionals in there. But Dr. Bola, Owolabi, did I get it right?
Thank you. Well done. Well done. Very good effort.
Yes, definitely here. And she's going to just quickly explain, because I'm seeing her title includes Equality Improvement Program. I didn't realize inequality was a thing here. I thought we just carried on and we just struggled. But it looks like the NHS actually cares. It's fantastic to see that they have an officer dealing with this and a director of National Healthcare Inequalities Improvement Program. So there's a program out there, and I'm going.
Absolutely. Thank you so much. It's such a pleasure to join you, and thank you for inviting me. So, look, I will start by saying that the NHS absolutely cares, and NHS England, as the organisation that runs the NHS, does care about the health of all of our communities, including people from Black and Asian communities. So yes, you are absolutely right. There is an entire dedicated national healthcare inequalities improvement program, which I am privileged to lead. So we do care, and we are not just saying it. I hope through this conversation you will see even more examples of how that is true.
When it comes to COVID now, there's this battle, this whole battle. We were told we're the problem because we're not willing to take the vaccine. We're helping to spread the disease. We've been then told that we don't get the disease. The next minute, we really get it easiest. We get this, we get that. We just became front line, and we're like, oh. We just make,
that was tough.
So that people, it was a struggle. So we don't know who to trust, and the severity of what really happened. We felt like people were being mistreated and dying in hospitals. It's something which has brought trauma, but some previous trauma has come into the conversation as well. So how are you dealing with that kickback from the Black community?
I think you've made a really important point that, during the course of the pandemic, and as we rolled out the vaccines, we realized that trust is a really important part of the work we needed to do. The first thing to say is that the pandemic itself, it really shone a very harsh light on, health inequalities that existed even before the pandemic. And the thing is, the pandemic itself then disproportionately impacted people from Black and ethnic minority communities. So, for example, if you caught the virus, you were more likely to have the severe end of the illness, you were more likely to be hospitalized and sadly more likely to die, from COVID-19 if you were Black or Asian. And we have all the data that actually proved that to be the case, especially during the first and the second wave. The other thing is it really impacted on, people from lower income households. It affected them a lot, and that was even regardless of their race or anything like that. And so when the vaccines became available, one of the things that we had to do very rapidly was to tackle vaccine health inequalities. And what I did, and lots of my colleagues, was we literally jumped on the phone. I was ringing the pastors. Some of my colleagues were ringing imams. Others were ringing the leaders of the Gujawaras, because we realized that these are the people from the community, of the community. The trusted voices and faces of the community. And we were very fortunate. The vaccine minister really supported our efforts. We had roundtable after roundtable with these community leaders and faith leaders. And the fantastic thing about doing that, they helped us to understand that where you put the vaccine is really important. So you'll notice that we started offering the vaccines in churches, in mosques, in pop-up centers within the community. All of that came from the many, many meetings that we had with community leaders and faith leaders. They helped us to see that. So actually, it's credit to them to say, look, people are terrified of leaving their homes, terrified of leaving their communities, but they will go to their places of worship. So that was the key. The other thing they said to us that really helped was the messenger is just as important as the message.
Okay.
Yeah. So we started getting people like Jennifer.
Yeah.
We started getting our community pharmacists, because you'll notice that in many of our community pharmacists, the owners of those pharmacies are often from the same communities that they're serving. So we got our community pharmacists talking. We got our GPs, GPs from the communities we were trying to reach. We got them getting the message out on WhatsApp. They were doing video blogs. One of our fabulous GPs sat with his mother, did a couch conversation in Urdu. They had a hilarious discussion, but it got through. That's the key. It got through. So the point was, the voice of the community mattered.
Yeah.
Where we put the vaccines mattered.
Yeah.
And making sure that we were being guided by the community in what we did was absolutely critical to manage that vaccine inequalities. And we did see the numbers begin to move in the right direction by doing that.
Now, you mentioned about the regional organizations were really great with you, yeah? When we saw some churches started allowing vaccinations, there's rumors of they've been paid off to do this, they've been paid off to do that, they've been paid off to do this, and so on. So there was which church sold out because the vaccination, and there's been that kind of culture that was there, especially with the early days of the vaccination, and we felt like they was just paying them off, and they was just going with it, even if it goes against faith and the belief. Have you heard that, or am I coming with something that just new to you?
We did hear some of that, and I think for us it was really sad because no churches were paid anything to do this work.
Oh, wow.
As a matter of fact, they were going out of their way, providing their premises free of charge. they had their workers who were having to stay late, to keep the premises open for us to be able to deliver the vaccines. And wow. I am eternally grateful to them, because as the numbers were coming through, and you could just see that the people who were the sickest people, the people who were getting hospitalized, the people who were dying the most from COVID were people from Black and ethnic minority communities. And then you put that alongside the fact that the communities that were least likely to come forward for the vaccines were Black and ethnic minority communities. That was really heartbreaking, to be honest. I will eternally be grateful to those pastors, those imams. Some of the imams did Ramadan twilight. Wow. Where when they were breaking their fast, they made provisions for the vaccine to be provided at the time of breaking the fast, because there were people who didn't want to take the vaccine during the day because they thought it would spoil their fast. So the mosques worked with us for them to be able to have their vaccine at the time of the evening prayers. The leaders of the Gurdwaras, good, they weren't paid, but actually what they did, I think in years to come, we will see the lives they saved by throwing their doors open. And not just throwing their doors open, they started talking. They got on the airwaves. Cool. They got on the airwaves. You know what I said, that the messenger is just as important as the message.
Yeah, correct.
They became the powerful voices of trust.
Wow.
Saying to the community, we can't let this virus just ravage our communities. There was a time when we were powerless, when we didn't have the vaccines, we didn't have treatments. Now we are powerful. We've got the vaccines. Come on, people. It was powerful. What they did was phenomenal.
Part of this kind of awareness situation is that, for me, it's important that we as a community kind of work with the NHS and now not against the NHS. And there's something called Core 20 plus 5. Core 20 plus 5. Please explain to me, because this sounds like some vitamin plus special medicine.
Absolutely. And the conversation we just had now about how, as we began to look at the data, we noticed the death rates, the infection rates, the hospitalization. So we thought about, actually, the COVID infection is one thing. There are other areas of health inequalities. What else can we do in other areas that affect our communities? So again, we went to look at the numbers, we went to look at the data and said, so who are the people? Who are the communities that are experiencing the most health inequalities? And we discovered two things. We discovered that it's the communities we describe as the Core 20 plus. Now, that Core 20 plus means, the Core 20 means people from the 20% most deprived communities. That's what Core 20 is.
Okay.
So they are the people and the communities that are in that most socio-economically deprived 20% of the country.
Okay.
We then noticed that apart from, the socio-economic status, there were other things like the plus. So in the plus box are, for example, people experiencing homelessness or rough sleeping.
True, yeah.
People from ethnic minority communities. People in the refugee and asylum system.
Okay, cool.
So that's what we described as the plus. So Core 20 plus are the groups of people and communities experiencing the greatest health inequalities, particularly in terms of, access to services and their experiences of services. Then the 5 refers to the clinical areas where we really needed to drive some improvement for this core 20 plus communities. So for example, maternity. Maternity, because when you look at the data and, the risk of stillbirths, having a stillbirth, it's higher among Black women. So maternity was one of the 5 clinical areas. The second one, severe mental illness. Again, when you look at it, the risk of having psychosis is much higher amongst Black men. So we chose that one. The third one is chronic respiratory disease. Okay. So for example, you'll notice that people from the most deprived areas tend to have a lot of this chronic, lung diseases. That means they end up in hospital and so on. So we chose that one. Cancer was the number 4. We wanted to be diagnosing cancer earlier. Rather than people turning up in A&E at stage 4, which is late, and discovering for the first time that they've got cancer. And then the 5th one was high blood pressure, hypertension. Because high blood pressure doesn't have any symptoms. People don't know they have high blood pressure. For the most people, they only know when they get a stroke or a heart attack. And again, high blood pressure really affects people from Black and ethnic minority communities
big time,
the most.
Big time.
So basically, core 20 plus 5 is core 20 plus the communities most affected by health inequalities, and 5 clinical areas where we can drive the biggest improvement for them.
Brilliant. Some of these subjects, these areas, is actually quite emotional. I've lost people to cancer. My friend, one of my best friends, who would be working on the station if he was still alive, died 4 years back because he got diagnosed in stage 4 of cancer, and he was sick for a good year. I remember talking to him a year before, and he's like, "Roger, something's not right." You know what I mean? And it was a year of toing and throwing, and then when it, that was and then he it's just that was a long one, long one. And then and blood pressure is massive, absolutely massive in our community, silent killer. But what I'm learning from you guys is that the pharmacists that have ready to do blood pressure, there's so many areas. Maternity, one of my biggest stats that I say to people: why is it in 2022 Black women are more likely to face complications, 5 times more likely still? Now, if it was in my time in the 70s, when I was born, I could say, you know what, I can take down the chin because of where we at as a community.
And this is, I can completely, and I'm really sorry to hear those very difficult personal experiences that you're just sharing there. And you can see why that core 20 plus 5 is so important, because it makes us focus. It's focus. If we can focus and say, look, it's this core 20 plus communities, and it's these 5 clinical areas. That focus is so powerful, because it means we can rally all our efforts, our resources, our energy, our time behind that, and make sure that in another 5-10 years, we're not saying the same thing about Black women are 4 times more likely to die in childbirth, and these sorts of things. Both
sides need to partner in this, because a lot of NHS staff go to churches, and I said to them, we need to encourage them to open up their eyes in the workplaces to injustices, and say, hey, no.
The church is a very powerful voice. That story that I was just sharing with you about how the pastors, the imams and others helped us with the vaccines. We want the churches to be helping us say to the community, you need to go and get your blood pressure checked. And now, we have all these community pharmacies that are offering free blood pressure checks to people over the age of 40 in the community pharmacy. The NHS is running this Help Us to Help You campaign, which is, if something doesn't feel right, don't just ignore it. Go and have a conversation with your GP, get the test. If the test comes back and it says everything is absolutely fine, fair enough. But at least you've not just sat on it. And the other thing we need people to be helping us to say is, we're now into the autumn booster. For example, go and get your vaccines. For these things that can be prevented, go and get your vaccination. Same again with screening. Breast cancer screening, cervical cancer screening, lung health checks.
Are we more scared? Are we more scared about the effects of our life? Hi, Jennifer, you okay?
Good evening, Roger, and good evening, Dr. Bola. It's a pleasure.
Hello, Jennifer. Good evening.
Hello.
Lovely to see you. Glad you could make it.
Okay, guys, right. So Jennifer is a lead nurse in shared governance. So I'm assuming, Jennifer, you're a frontline person. Yeah. When it all, you could say, when it was at its worst, when it came to COVID. Yeah.
That's correct. Yes. I am a senior nurse in the health service, and I worked in intensive care, so on the front line during the second wave, actually, to support my colleagues and patient delivery. But I've also been one of the nurses in charge, one of the lead nurses on the vaccination programme in the Midlands. So I have been delivering the vaccine and managing teams of wonderful volunteers and nursing staff, admin staff, St John's Ambulance, delivering up to, 1,500, 2,000 vaccines a day up until, I'd say, probably Christmas last year.
Can I just say that Jennifer did an absolutely stunning job throughout, this whole vaccination program, reaching deep into the heart of the community. We were on numerous calls together with the community with the minister, with the pharmacist, with the faith leaders, never tiring. And I just want to, on this airwave, just say thank you, Jennifer, for your selfless effort working with us throughout. Thank you.
Dr. Bola, thank you. You've been such a role model. And what drives me is the patients that I cared for, and the fact that I have family members who didn't get vaccinated, wouldn't get vaccinated. And it's that drove me to change hearts and minds and increase confidence, reassure people. So, yes, working with people directly in the community has been extremely effective. It really has.
Yes.
And that work continues. I was doing it last Saturday with a whole host of partners, volunteering. We were doing health checks, actually. We were doing blood pressures as well as giving vaccine advice. So organisations like CALM, the Caribbean African Health Network, came to support RAFA. We have support from the Church of God of Prophecy, Health Watch, and lots of nurses who volunteered their time to just do blood pressures, give vaccine advice and other health advice, actually.
And this is the other thing, which is the making every contact count. So the question you were asking me about, what is it about the community? Why are people scared? I don't think it's a case of people being scared. I think it's a whole range of things.
Okay.
Sometimes people are on 0-hour contracts, and making that special appointment to go and get a vaccine, to go and get your screening done, really makes a difference in people's pockets. So as a GP, I know that. I work in an ex-mining village, and I know that for many of my patients, taking time out to come and see me at the surgery is a really big deal. Because they are on 0-hour contract. So I think some of the lessons from this whole rolling out the vaccine is that actually we can use the making every contact count approach, as Jennifer was describing, to help people. So if you've turned up to have your vaccination, we can get your blood pressure checked while you're there, for example.
Yes.
Some places were also even doing diabetes checks. It saves you going back and forth, reminding you about the screening programs on offer. Sometimes it's that people don't know, that by this age, you should be having your breast screening done. By this age, you should be having your cervical cancer screening done, and so on. So I think using the vaccine as a one-stop, making every contact count for other areas of health inequalities was a massive lesson as well.
It's that holistic approach.
Holistic approach. You are utilizing this experience with COVID as not only a one-off situation and walking away. You want to alleviate because it hurt me when my friend, I never forget this. My friend, he was sick it wasn't 100 for over a year, and we would talk about it, and they kept on saying, we're going to try this, we're going to try that, and then I'm thinking, wow, how come everyone else gets caught at stage 1 and 2 and you get wait to 4? So it's like that whole you know what I'm saying, other system. But it's fantastic because, like what you're saying, is ultimately you're opening up more tests out and more opportunities to check things out. So we saw the NHS and the government as one entity, and was like, you don't actually care about us, do you? You know what I mean? And we had to keep on fighting.
And this is why, as we were saying earlier on, we had to say it's not just about COVID. It's not just about the COVID vaccines. That's where the core 20+5 came from, which was there are these other 5 huge areas that we need to focus on. We need to talk more about cancer. We need to talk more about screening. Understand our family history. Get the information out to people. If you've noticed something that doesn't feel right, you've got some concerns about changes to your body, talk to your GP. And as I was saying to you earlier on, we know that there is a much higher chance that you will have high blood pressure amongst Black people compared to the rest of the population. Again, diabetes, type 2 diabetes, the likelihood of having it is much higher. It's 6 times if you are South Asian, for example. It's that prevention is better than cure. It's trying to get that over the line to people that prevention is better than cure. It's better to have this screening. It's better to have the vaccines. It's better to get it checked out. Do you see what I mean? Than waiting for it to be too late.
Well, I think 2 things. I mean, obviously, since the first COVID vaccine was given, we know it's saved lives and helped tens and tens of thousands of people stay out of hospital. But the virus is still with us. And so it's still important to get vaccinated if you haven't.
Absolutely.
It isn't too late. But what I will also say, as you mentioned earlier, that the pastors, the imams, the trusted messengers in the community, I've worked very closely, particularly with the Diocese of Westminster, the Churches of God of Prophecy, and those individuals have been really, really key to delivering factual information alongside healthcare professionals to change hearts and minds and build that confidence and reduce the inertia, really, because people think it's never going to happen to them. And we know COVID doesn't think, well, if you're white or Black, it's going to attack you. It attacks anybody, regardless of age.
You are absolutely right in that it doesn't discriminate in terms of who it infects. But the problem is because people from Black and ethnic minority communities tend to also have these other medical conditions like diabetes, like high blood pressure. It means that's the reason why when people from these communities got the virus, they became sicker, they were more likely to be admitted, and very sadly, they were more likely to die. So for me, it's about what is the legacy we're going to leave behind us from this whole pandemic? And for me, the legacy has got to be that people don't go around not knowing they have a high blood pressure. People don't go around not knowing that they've got cancer. They're not walking around not knowing that they've got diabetes. They're coming forward, having the test, getting the diagnosis, getting the treatment, so that when they're confronted with these nasty viruses, they are better able to stand their ground. The problem is most people could not stand their ground because either they didn't even know they had these conditions or they had it and it wasn't well controlled. So for me, the biggest legacy has got to be greater awareness amongst people, overcoming fear, overcoming their hesitation, having trust, because trust is the key. That's the thing. It's the trust. Having
and
trust.
It takes time, doesn't it, Dr. Bola? Sorry to interject. It takes time to build trust. So
of course,
we can't stop the messages, and it's really good that you're doing this awareness campaign. The messages have to continue. And
definitely,
the health service are going into the communities because people will say, and we hate the term, we're hard to reach as a community. We are not hard to reach. Tony Kelly, a diabetes champion who supported us in one of our community events last week, he has lived with diabetes 2 for 18 years. He doesn't take a single tablet. And he talked to the community about healthy living, not eating takeaways, exercising, sleeping well, getting his blood pressure checked. And that's the sort of thing that is really, really important for our community to hear. It really is important. That's self-care. It's you've got to take some responsibility for your health.
Guys, this is absolutely wealth of knowledge, and some of the conversations, there is an element of self-knowledge. I'm very pro in terms of putting knowledge out there for health. I think poorer communities, you highlighted in the core 20+5, it is very, very, very true, all the points in that area. And I feel that being poorer kind of leads to better diets. I speak to my friend in America. He's got the same problem over in America. People in worse in poor areas, they don't go out to get their healthcare checks. They don't do this, and we've got the NHS over here, and we're still not accessing because every day we get doctors, and then you both are in something. And I'm not anti-doctors here now. We've seen a transition of doctors now. This is not even on the list, so sorry if this is totally out, but I thought I'm just giving how people feel when it comes to GPs. Before, we'll go past the doctors, book our appointment, and then we go and see him, and we make a phone call in the morning, and we book it in for the rest of the week and whatsoever. And a transition of how to interact with the GP, especially since COVID, the changes and movements of it has made things sometimes a bit more awkward for people in areas where you can't just book in and say, can I come in tomorrow because my work can allow me to come.
But I will say though that is why I will remind people that we do now have this community pharmacy blood pressure check service. Bear in mind, community pharmacies have no front doors. There is no front door.
No.
You literally just walk in to your local community pharmacy. So I really want people to make the most of that. And you remember we were talking about making every contact count. That's why we're trying to use the opportunity of when people are already there anyway, they've come to have a vaccine. What else can we do during that period that we've already got them? So you're not having to go and ring and make an appointment and things like that. And I think the other thing is in terms of, just raising awareness about what to say when you do contact your healthcare professional. Because what I find is sometimes when my patients ring me, they may not have the words to properly describe what is happening. So then I have to do a little bit of translation in my head of, right, I think this is what this person is trying to say. Oh my goodness, that's a red flag. I need to refer them. So I think another thing that I'm hoping we can achieve through this podcast and again through our community voices is to explain to people what those red flags are. So, if you are suddenly losing a whole load of weight, and it's not because you're fasting, it's not because you're exercising more, that's a red flag. Get it checked out. If you find that you're drinking gallons of water, don't just say, oh, my body loves water. It's not right. Say something to someone. Look, I'm drinking a lot of water. I'm peeing a lot. Could this be diabetes? Get it checked out. It's those sorts of things in terms of just raising awareness about what are the sorts of things that if you notice it happening, it's not okay. And the other bit, prostate cancer is another one that I want to talk about. So we know that prostate cancer affects 1 in 8 men generally, but it affects 1 in 4 black men.
I just got told, guys. I just got told, like, you know what I'm saying? So, see a podcast, why just gone red, and he's just got told that,
And equally, just to add, if your feces is rock hard for days, or you're not going to the toilet, these are the things, or you're passing blood when you're doing your number 2, you're having your poo, that's not normal. That's a red flag as well.
Yes.
So get vaccinated, look after your health. It is your wealth. It absolutely is.
So you guys are making me really red with all that man talk. I was happy listening to all about the women and maternity. But when you get to men, I was like, yes, I will. But just going into, before we close off, we're going into 2022 Christmas. Yeah, you guys have, obviously, from a GP perspective, from a nurse perspective, faced a traumatic 2 years. Let's be honest, within your teams, within the organisation itself, with NHS. Now, because as much as we all got relatives that are in NHS and in some capacity, how are you guys preparing for almost the first winter without restrictions? I know you're encouraging COVID vaccinations, but how are you, and is any encouragement for us to, I know we can take injections to make things easier for you guys as well, but how are you guys feeling confident going into this winter that we're going to get through this, not so much unscathed, but it's not going to become a pandemic? It'll be the opposite of pandemic. Well, it'll be controlled. It'll be a controlled situation. How are you feeling about that? Which
What I will say is, I'm going to echo what Jennifer said, which is, this is a two-way street. I can say that we as healthcare professionals are confident that the NHS has invested huge amounts of money to make sure we have the vaccines. So in terms of avoiding a situation where we see the numbers rocketing again in terms of people getting infected or people getting admitted or people dying, we have the vaccines. Not only do we have the vaccines, we have wonderful people like Jennifer. I am doing what I can as well in my own surgery. We've got healthcare professionals who are offering services over the weekend into the evening. We've made it so much easier to get these vaccines than pretty much anything else. And so I'm confident in terms of the preparations we've made, as a healthcare service. My plea to people is, please meet us halfway by stepping forward, to actually come and take advantage of those things, because it's a bit pointless if I'm sat there at the surgery or Jennifer is sitting there in the community with our nurse colleagues. We've got the vaccines, we're kitted and ready to go. If people don't turn up, then how can I sit here and say that I'm confident that we're not going to see a rocketing of cases? I think it's when we as healthcare professionals and our community join our efforts together, that is when we can say we are confident going into this winter that we will have a smoother ride than we would if people don't take their vaccines. Jennifer?
I absolutely echo all that you've said, Dr. Bola. You saw what the NHS did. It dug deep, it stood up, and it responded. But it took its toll, and we don't want to go there again. So I can only echo what Dr. Bola has said. And we're not just talking about the vaccine as in COVID. I'm also wanting to make a plea that people get their flu vaccines also.
Yeah.
Yes.
Get their children immunised. That there's just, you mentioned America. All of what we are doing is free.
Yes.
So the service is there. The professionals are trained, ready.
Yeah.
Just as Dr. Bola has said, meet us halfway.
No, 100%. Guys, I thank you for your time, and in part of this series, we're going to look into the validity of the vaccine. We're speaking to professionals in different areas. So don't worry, guys. If you feel like you got something to say, wait right there, because we're going to be dealing with, and we even got, how can I say, testimonies or you know what I mean, of people going through some extreme situations. So don't worry, guys. If you do have a comment, and if you want to say, so where's Jennifer now in Birmingham? Because as I'm in Birmingham, I'm going, you know what I'm saying? So I believe she'll be working with a church I know well, Church of God of Prophecy, very well actually. And I know there's been a massive drive through them. I'm in conversations with the people who go there. So it's fantastic to hear the interactions that's going on. But again, I just want to reiterate that both Dr. Bola and both Jennifer are both saying, please, guys, meet them halfway, have a and they're happy to have the conversation wherever you at. You know what I'm saying? So please, guys, have the conversation. If you're not confident, there's professionals on that open to it. There's no brick wall. Thanks again for your time, guys, and I appreciate you, and I appreciate your efforts and help for our communities out here. And this is Roger here, alongside two special people, man.
Thank you, Roger.
Thank you very much.
Thank you, Jennifer.
Thank you so much. Lovely to meet you. Thank you, Dr. Bola. Pleasure.
Thank you so much. Bless
you, guys. Thank you.
A real honour to be on the platform with you, Dr. Bola.
It's always such a pleasure, Jennifer. Thank you very much.
Pleasure, guys.
Good evening.
Hey, this is your Bishop. This is your Bishop from Rock Solid. Thank you so much for watching us on YouTube. Thank you so much for clicking and subscribing, and also sending these videos to other people as well. We are so hungry to get your support. So remember, check us out on our website, and also check us out on Insta, and wherever you want to find us on Spotify. You can play us all day as well. And just make sure that you are supporting this channel, that we are developing our agenda towards music of Black origin, and that is gospel music with a message. So please walk with us on this journey. Bye now.